Hi everyone, hope you're all doing good. So, I usually don't put such kind of videos, but today I couldn't stop myself because I'm highly disappointed. I know almost every other mental health professional have been posting the same thing or the other because they all are disappointed. Um, I have come across so many posts from some random influencer, from some random person, random priest, Baba, like others, right? And they are coming up with the mental health awareness. Nice, but in a wrong way. That's not nice. Okay, treating depression through salt. Yes, I heard that, and maybe like that video got viral. Okay, one lady coming up with the salt technique and say that negativity will be gone, और आपको डिप्रेशन नहीं होगा, डिप्रेशन तो भूल जाओ, नाम भी नहीं सुनोगे आप उसका. Nice. And some then there is one Baba who has come up with a different technique. वो फूक मारते हैं और आपका सर दर्द चला जाता है. Nice. Again, I think like all of you must have gone through all of this. आपने वायरल वीडियोस देखे होंगे, तो नहीं देखे तो प्लीज़ देखो. और बट उसने उससे कुछ सीखना मत, राइट? And then there is an influencer who has been taking sessions. Oh my god. So their content is very different, but they are taking sessions and they are literally posting that I'm conducting one-on-one therapy sessions, so please contact. Nice. Okay. And I just hope that that influencer doesn't get a suicide case. I just hope. Yeah. But I can't help. I just can't help. I'm just like, like literally scrolling my Instagram nowadays and getting like, all these posts in my feed, and so disappointing. Now, the next thing is a lot of people, a lot of students are coming up with, I know students are keen. I understand. I also teach. Being a professional, I respect that you are so keen and passionate about learning, but don't take it as fascination. So I've come across so many people and say, "Oh my God, this field is so fascinating. I'm so fascinated towards psychology. मुझे भी बताओ ना कैसे होती है, और मैं भी सीखूंगी, या चलो एक बार मैं देख ही लेती हूँ कैसे आप लोग माइंड रीड करते हैं." माइंड रीड? आर यू सीरियस? माइंड रीडिंग? एंड देन देर आर पीपल, कभी रैंडम पार्टीज़ में मिल जाओ, कुछ भी मिल जाओ, ये आज भी हो रहा है. ओ, आप पागलों के डॉक्टर हैं ना? अच्छा. अरे तो आप तो साइकोलॉजिस्ट हैं, आपको तो पता होगा मैं क्या सोच रहा हूँ या सोच रही हूँ. आप तो देख के ही बता सकते हो, या आप तो 24 घंटे ऑब्जर्वेशन पे रहते होगे, है ना? मतलब हर टाइम आपको तो देखते पता लग जाएगा ये इंसान कैसा है, ये इंसान कैसा नहीं है, राइट? वाओ, सो अमेजिंग, योर वर्क इज़ सो नाइस. हमारा देखो कुछ भी नहीं है, आप लोग की ज़िंदगी जी रहे हो. ओके, ब्रीथ, राइट? आई एम टेलिंग यू द एग्जैक्ट स्टेटमेंट्स, एंड इसमें कुछ गलत नहीं है. ना ही मैं एग्जैजरेट कर रही हूँ यहाँ पे, ना ही मैं अपने आप से आके बोल रही हूँ चीज़ें. दिस इज़ एक्चुअली हैपनिंग. बट माई क्वेश्चन इज़, वाई डोंट यू क्वेश्चन अ डॉक्टर? Okay, why don't you question a general physician or a neurologist or a dentist or any other person or even a surgeon? Wow, योर फील्ड इज़ सो फैसिनेटिंग. आप सर्जन हैं तो आपको सर्जरी करने में कितना मज़ा आता होगा ना. सो फैसिनेटिंग. क्या मैं भी एक सर्जरी कर सकती हूँ, या एक बार ट्राई कर लेती हूँ, है ना? वहाँ पे क्यों नहीं पूछते आप? जनरल फिजिशियन से दवाई लेते हुए ये क्वेश्चन क्यों नहीं करते कि क्या मैं इस दवाई से एडिक्ट हो सकता हूँ? तो सिर्फ साइकाट्रिस्ट को क्यों क्वेश्चन आता है दैट इस दवाई से एडिक्शन होता है? वाई? दिस इज़ माई क्वेश्चन नाउ. उनके लिए बहुत प्रैक्टिकल अप्रोच है, लेकिन हमारी फील्ड के लिए कोई प्रैक्टिकल अप्रोच नहीं है. सब कुछ जनरल है. सब कुछ इस फील्ड में सबको ऐसा लग रहा है कि ये तो कोई भी कर सकता है, ये तो सब लोग कर सकते हैं. एंड दैट्स द रियल फीलिंग. देर इज़ नो प्रैक्टिकल अप्रोच योर. सो दैट्स वाई वी ऑल आर फ्रस्ट्रेटेड. This field actually needs a proper process. We have have 5 years degree. Then after that, even like those who are clinical psychologists did like 2 years MPhil, RCI, and then there is a therapy approach where we actually go ahead with a proper course and get an expertise license in therapy, and then we practice it by practicing under a supervision, and then we go ahead with our own practice after a good 5-6 years of experience. I'm not saying after masters it's wrong to take up a job or something. It's okay. I've also done that personally. But I have never said this in my entire life after doing a one course that now I'm a therapist, or after doing a one course that I can also be a practitioner or I can take clients. No, you're learning. It's not easy. What if there will be a suicide case or depression? You will listen, because a lot of you think ना कि सिर्फ सुनने का ही तो काम है हमारा. We are a good listener. You need to be an active listener, and just the job is done. Please no. This is a very very wrong approach, and this is very very, like whosoever is spreading this awareness, like that person should not be acceptable here. Okay, I know, like you are finding me mean right now, you're finding me rude, but I can't help it. Actually, this is the truth. Okay? Please, if you want to be a professional, so behave like a professional. Go through a proper process. Take proper degrees. These courses, I'm not saying it's wrong, but it has a process. This is an add-on skill. Okay? Later on, these courses will help you to use some techniques or approaches in the process, right? In the treatment process. So go ahead with that. And there is no end to learning. If you feel like confused today, so please take help from professional, take a supervisor. Like there are a lot of books, researchers, go through the data, go through it, you will get the right guidance. But this is very very wrong that people who have no knowledge about this and they are using the term so casually. Depression, OCD, bipolar, labels. Why? You have no idea. Those people, those who are going through all of this, you have no idea how much they are suffering. They are actually suffering. And depression, highlighted term, used so casually nowadays, it's actually a silent killer. People committing suicides, they can't even express, and you are saying ये कुछ भी नहीं होता, बस अपनी चीज़ें थोड़ी चेंज कर लो, अपना लाइफस्टाइल चेंज कर लो तो सब ठीक हो जाएगा. Really? Tell me something. Is it a joke for you? See the suicide rates. See the increasing suicide rates now. So, and it is something. This is very serious. And everybody needs to take this very seriously now. Really. Don't use such terms casually, please. Don't take our profession a fascinating profession. It's a profession and it's a serious profession. Mental health means something. I know all of you can relate to this, but please, 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 it's a request. Spread the right kind of awareness and stop using it as an earning source. Of course, every professional is earning in their field, but in a right way. And we are also doing the same thing, right? I am also a professional. I am also doing it, but in a right way. And if I think that I'm going wrong somewhere, I learn, I talk, I ask, I read. That's what I do. And to all my students, I also give the same guidance, same suggestions, right? So even like I know all my fellow professionals will agree to this. So please stop trusting all these remedies. I'm not saying it's wrong. The spirituality aspect, the other remedies and other things can help, but not in such cases. Salt डाला negativity चली जाएगी, फूक मारा तो depression चला जाएगा. Please stop this. It's a request, right? Take our mental health seriously, take our field seriously, and go with the proper process. That's all I want to say. Okay? Spread this kind of awareness as much as you can, right? Thank you so much for patiently listening, and I trust you now that all of you are going to spread the right kind of awareness, because people are literally looking up to you, and when they ask for help, they literally trust you that you will help them. So please don't take it for granted. It's a request. Thank you so much. Take very good care of yourself. Spread love.